Hey, how are you?
Hello. Thanks
Hi.
for joining me, Caroline. How are you?
I'm good. I'm good. How you doing over there in New York?
Good, just doing our best here. It's kind of a crazy place. We still aren't allowed to do any elective procedures, including injectables, but we'll get there. So just to briefly introduce you, so Dr. Caroline Chang, board certified dermatologist with her own practice in Rhode Island. And it's pretty cool. I was reading your bio, and you were an art undergrad at Princeton,
I
right?
was. Yeah, I was. Yeah.
That's
So
awesome.
I
That's
yeah,
really
I
cool.
did it was classical archaeology. I did Latin, ancient like Latin language and art history.
Oh, that's
So,
amazing. Yeah,
yeah.
very cool. I dabbled in like some sculpture and painting, like, earlier in life, but never really studied it in such detail. But good for you. Very cool. So, yeah, I mean, we can just jump right in. I know you do a lot of this stuff, and it's definitely a part of my practice as well. So I figured we can chat about, some of the concepts behind what we do.
Perfect.
Cool. So, people ask me about prejuvenation, and it's written about a lot online. Do you believe in it? Like, what types of prejuvenation are possible, in your opinion?
Yeah, so I actually had to look up the term. I guess it's like a trendy thing and I wasn't on the trend, but I looked it up and I was like, what's prejuvenation? And it's all about prevention. So definitely a super like proponent of prevention. So my understanding is that, with the idea of prejuvenation is to do treatments to maintain your look and maintain your youthful skin, your healthy skin before it turns to sun
Right.
damage or lines or wrinkles. So I definitely support that. So things I love are like, for 100%, I tell every patient who comes in, skincare, sunscreen, retinol. Like
Yeah.
you need to, you just, if you're going to come in and you're going to get any procedure like Botox, you want to follow that with clear skin and healthy skin. So definitely skincare is really important. And as far as like injectables, definitely it's a controversy, maybe like how young or when you would start an injectable. And my party line is starting when you just maybe start to see lines forming.
Hmm.
I don't think that, if you have no lines at all, like, and nothing there, that you really need to like get started just at that point. But maybe when you start to see like just the hint of it, you're like, I gotta get in. Because actually at that point, as you know, it's those fine lines are somewhat reversible if you're consistent with Botox or toxin.
Yeah.
And another thing that I'm noticing as far as prejuvenation is that there's a lot of like mid-face volume loss, which
Right.
occurs not only when you're at an advanced age, but actually can start as early as 30. If you're, athletic, if you have a,
Sure.
thin build, mid-face starts to fall really, early. So
Yeah.
yeah.
So I guess,
What are
do
your
you
thoughts?
think that a filler can be preventative? Because I get asked that sometimes, and I guess I have, pressed no. Uh, I don't think that I agree with you 100% on all the skincare and the neuromodulators. I think that you're absolutely right. But with filler, I tell people that I don't think there's really much rejuvenation there. Some people say, well, if you're injecting filler deep, it may kind of stretch the muscle a little bit. And some people think that that's maybe strengthening it. Others say, well, it's maybe weakening it. I don't know, but I just haven't seen enough evidence to make me believe that using filler is going to prevent something from happening. I mean, I think of it more as sort of concealing something that's already happened. But I mean, do you agree with that, or do you think that there's something rejuvenating about certain types of filler or how they're placed?
Yeah, so I think there is something rejuvenating about it, but it depends on how it's placed. So if you're doing periosteal injections right to the bone, I don't think there's much. I think that's rejuvenation, but not necessarily you're building anything for the future. But injecting, well, now we're finding that even with like something like radias that incite collagen growth, and so my feeling is on that is if you're using something like a cannula or even with a needle technique and fanning or putting it in the dermis or the superficial subq, that you are inciting a injury repair process
Yeah.
so that your body does, as it's taking away the filler or processing the filler, it is also signaling your body to build collagen. With super thin fillers like those, or like dilute radius, or Restylane Refine, fanning that through the superficial, like the dermis, I think that over time it does build collagen. So I think it can. I think it depends on the technique and what the patient needs. So it's
Yeah.
not always, you can't come in and say, I want the prejuvenation version.
Right. Yeah, no, I
Eh,
agree. And I guess some people make that argument for thread lifting as well, that those tracks of collagen, I mean, it's really scar tissue, but I guess it's maybe disorderly collagen to some degree, but it's still
right.
nonetheless maybe collagen. And so, yeah, maybe there is something to be said for that, having some prejuvenating, I don't know, qualities. So yeah, that's an interesting discussion. In terms of favorite places to inject, I know in my mind, like there are certain areas that I love to inject. So when it lines up with what the patient wants, I'm like, yay, because I know that the satisfaction rates are kind of high for those areas, and others are like,
Right.
eh. So do you have certain spots, or you're like just, well, whatever I guess that individual needs or wants?
So I would say most people, especially if they're first coming in or if they're first ready to do fillers, need mid-face. They need their mid-face, because this
Hmm.
is where I find people tend to fall. So it's either here or, out here. So I like to do a lot of like not nasolabial, but like mid-face here injections. And I think that it often, people will come in and say, I look tired. I think I need my tear troughs filled. I think, I want to peel. And I'll say, listen, I think that what you're feeling is that your face is falling and flattening, and let me give you a little boost. And a mid-face filler does that really nicely without making you look super different. It just makes you look a little more awake. And my second favorite place to inject are lips,
Okay.
because
Yeah.
everyone loves lips, and everyone could, not could use it, but there's always something that you can do to kind of, for me, that you can kind of enhance
Yeah. Right.
for a lip. What do you
I
think about lip fillers?
Yeah, no, I totally agree with you. So I like lateral cheeks. I kind of focus on the zygomatic
Mm,
prominence primarily. And so I don't do like a ton in the kind of medial cheek area. I like to bring the attention out more laterally. So I
mm.
100% agree there. And then lips, yeah, I would say that's, like it's a close second, if not, one, maybe tied for first. Yeah, I think those are the most kind of common sites for me as well. And, I try to avoid the nasolabial folds if at all possible, and try to talk people into other modalities. But, I think if they're very deep, sometimes, a little bit of work there can take the tension off of them.
Yeah, for sure. I think when people come in asking for this, I always say, if you want to do this, you got to do a little here, because it's falling down. So you got
Right.
to pull the weight off before you think about filling that. And even tear troughs too. You need the support laterally and in the
Yeah.
zygoma. You can't just fill in the tear troughs, because it won't
Right.
give you the
Yeah.
full
Any
effect.
any dr- yeah, I mean I agree. I think the tear troughs are kind of a dreaded territory for a lot of folks, a lot of providers anyway. Do you agree, or do you feel like it's just, no big deal?
Well, I don't ever want to say it's no big deal, because it's definitely a sensitive area, and there's a lot of blood vessels, and it's very thin skin. And so, your risk of bruising, swelling, that kind of thing is higher. I like to do procedures where I can tell someone confidently, I think you're going to be fine. You can go out that night. But with a tear trough, I always say, like, I can't promise that you're going to leave and you're going to, not going to have a large bruise. I think for tear troughs, I like them. I use a cannula for those. I think it's really nice when you can get a nice result for someone.
Yeah.
But I think definitely the biggest thing that I have to, that is in the discussion in the consultation, is that you can have your tear troughs done, but you're going to need support outside of that,
Yeah.
in the
Yeah.
zygoma, around the eye. So that's the main thing, is that people, if you're focused on tear trough, we can fill them, but you may not get that full outcome that you want if
Yeah,
you're not
and I
willing
think
to.
no, totally. And there's good data to support that doing lateral cheeks or zygoma type injections will improve the tear trough area. So, I think it's a better place to start, and then if they need some extra boost, then kind of go right into it. So, but I agree. I mean, I've had not that many like bad bruises, but the ones I remember like are from the tear trough area. And so I've moved away completely from needle for that. I know some people will use the needle just because they feel like they can direct it better, especially like onto periosteum, but I just rather not risk a bad, bruise. So
Yeah, I agree. I do use needle if I need to. I just find there's with the danger zones, like you end up, for me, like you don't want to inject in the high risk areas, and then it's hard to get the product in those areas. If you're trying to avoid them, so then you end up like, how do you fill over the danger zone? So I like to sort of use the cannula. I think is really helpful there.
Yeah, for sure. So, and then in terms of the types of fillers that you use, do you have like a range of different ones that you just pick and choose, or do you kind of stick to certain main fillers in your practice?
I stick mainly with the Restylane line of fillers, and I do use Radiesse also. So I would say those are the main ones that I use. When I opened my practice, I had to make a choice of what I wanted to stock and what I wanted to have available. And it is definitely, it's hard to have every single filler. There's probably 20 out there available. So I went with the Restylane line because I personally really there's some of those products I really love, and they've always been, consistent for me.
Yeah.
And so I use mainly Restylane. I think that both, like, all the companies have a wide range of fillers and products to use in different locations. So what I do is, what I tell my patients is that, tell me what area what do you want to work on, and I'll make the choice of which filler to use. All the fillers have such different qualities that, yeah, I definitely have I have my favorites for certain areas, I suppose.
So for cheeks, what do you prefer?
I like Lift.
Okay, and then for lips?
My go-to would be like a half syringe of Restylane, which to me is just enough to give someone a boost, but not change anything about the overall look of the lips, just define. I've had the pleasure of using Restylane Kiss, the new one.
Oh, I was going to ask you about that one.
Yeah. I've got that in stock now, and I have to say, I really like it. So the way they describe it is that Kiss is in that same family with Refine and Define. So it's that sort of newer technology. It incorporates with the skin a lot better, and it's a little softer. The expression technology, and it's sort of in between regarding like G prime. It's in between Refine and Define.
Okay.
So you can inject it superficially without seeing lumps or with the filler. But it's, in a way, because it has a little bit more hold than like Restylane Refine, you can use less, and you need less to give.
Oh, okay.
So what I let,
like a 1 cc, or
it comes in a 1 cc. I don't know, as far as I know, that's the only size. But what I like is, think about, like, if you're going to use Refine, sometimes you're using like almost 1 cc maybe in the lips. With Kiss, you might use 0.75, and then you have a little left over to maybe put in the nasolabial or the marionettes or the perioral lines, so that it might give you a little more wiggle room on that regard.
For sure. And then Kiss, I read it's supposed to last longer. Are you finding that?
They said it's supposed to last a year. I don't know yet. I think that the newer expression, that expression technology, it could last longer. I think it does last longer, but I don't know. Personal experience wise, obviously, I've only just started using it.
I mean, you and I are alike. I also just stock Restylane products, and I use Silk in the lips, and I've been overall pretty happy with it. I mean, when I'm done injecting, there's always a little bit of lumpiness, always. And I tell people that it's going to smooth out, and it always smooths out, within, I would say, a week. I inject superficially, so there's no concern for intramuscular, issues. But yeah, I don't know, maybe with the Kiss, it's going to be like a smoother type of appearance from the get-go. I also tell people just kind of to massage the area, and it tends to kind of be, not an issue. But yeah, of course, it never lasts a year. I mean, Silk, will last maybe 6 months tops, for the most part, and So it's good to know there are newer
do you
things
have a
out
lot of like post-procedure swelling with silk, or you do people do
there. Yeah,
any?
I mean, everyone's different with the swelling. Some people don't really swell much, but yeah, some swell quite a bit. So, I find that I don't give steroids routinely. I do for like lip surgery, but not for injectables for the lips. But some people who've had the filler in the lips, other practices, they'll come in and they'll request like a Medrol dose pack essentially because they know they swell a lot. So maybe the other people just aren't telling me that they got kind of swollen, but I haven't heard too many major complaints about that.
Perfect. I offer prednisone to my patients for lips because of the swelling. I would say there's a twofold reason. Number one, obviously, it avoids that awkward swollen phase where that people, generally don't want because they want it, in general, I feel like my patients want, subtle improvements that people don't know you had something
Yeah,
done.
my
So,
yeah.
So, you can't have like a day of having the lips double your size it's not ideal. So number one, I like to offer a little prednisone for that. But the second thing is that I've noticed is for some people, when they don't take it, their lips swell and they like it.
Yeah, that's right. And then they get upset like, oh, I thought that's
And
how it was going to be.
and it comes down. So I
Yeah.
think for perception purposes, I often counsel my patients. I say, listen, it's okay if you don't have prednisone, but just so you know, it's gonna swell and it's gonna be underwhelming in the end.
Yeah.
Whatever you're gonna see in the end it's not gonna be, and you're probably gonna like it in a couple days.
Yeah.
You know.
Do you, like, say you use the, I don't know, 0.7, 0.8, will you save the remainder of the syringe, like, for that individual and say if they come back within X number of days that you'll inject the rest if they need it, or do you not offer that?
In general, I don't. I feel like there's always a place to put it. And I think you have to sort of, what I do is I plan out, I try to do my best to plan out or
Mhm.
predict what someone might need. If I think they only really need a half syringe, I would go for my trusted Restylane because I know how that works, and it's a half, and it comes in halves, half cc's. For someone
Mhm.
who we take a 1 cc syringe, I would say that there's probably always a place to put it. If you're going to put it in the lips, you would need support, lower in the nasolabial to help, support the weight of the filler in the lips. So I find there's always a place to put it. If there are certain cases where
Mhm.
I'd say I would definitely stop and say, listen, let's take a break and maybe come back in a couple of days. And one of those cases would be if someone starts to swell a lot. And
Right,
if they
right.
swell a lot, I'm like, I say, I don't know what's going on. I don't want to put more on one side and try to chase swelling. So there are certain cases where if someone is like getting swollen, or if let's say they have like a bad bruise and it,
Yeah.
it's altering the look of the final look, I might say, listen, let's just take a break and come
Right,
back in a
right,
couple of
right.
days.
Yeah, because I find that the swelling is asymmetric. So like
Right.
the quantity injected may be the same from one side to the other, but then like you said, like maybe you just nicked a little tiny blood vessel on that one side, and then you have just more swelling, and it's like almost impossible to then even them out. So then I find, yeah, I agree. Then just kind of like take a step back and have them rest, come back, and usually at least a week, and then you can kind of see where you need to add. But yeah, different ways of doing it. And I agree. It's just like you have to kind of sometimes figure it out on the fly, and make adjustments.
Right, exactly. Sometimes I just say, look, I'm just going to admit there's too much going on right now, and we're just going to take a break.
Right, right. How about Caroline, for neuromodulators? Do you have like a preferred one, or do you offer sort of all three or all four, I guess?
I offer all. I have all of them in stock, and I generally use Dysport
Okay.
because it's the Restylane family. It's the the Galderma. But I really like Dysport. I think the one thing I like about it is that I find it kicks in faster, or it takes effect faster,
Mhm.
which in this day and age of instant gratification,
Yeah,
people like that. Also,
yeah,
people can come back sooner for touch-ups if needed. It's come back in 5 days or a week. But I tend to use Dysport, but I do offer all of them, and I think they're all great. And when people ask me like, which one do you prefer, I always tell them I've put them all in my face. So it's not I don't choose one or the other. Like I don't have a preference for myself. I will use whatever's left over. Like,
Yeah, yeah.
and you know, so there's no issue there. I personally, I think like the studies show that they're all very similar, but I find like
Mhm.
Botox to be a little more precise. So in
Yes.
certain areas, and there's less diffusion, is what my feeling is. Although I know
Yeah.
this, but in certain areas, I prefer something like a Botox to Dysport. And so
Mhm.
areas I would choose are like something like masseters.
Okay.
I like Botox there. I would sometimes crow's feet,
Hmm.
you
Hmm.
know, the spread, the diffusion just doesn't work. But in general, I think I can do this, get the same results with all of them.
Right, right, yeah. I guess I probably upset my Galderma rep because I decided initially my practice to just use Botox because that's what I had trained with. So I just
Yeah.
felt comfortable with that and feel like figuring out all the different dilutions and how exactly, it was clinically, affecting change. And so I'm like, let me just stick to what I know. So that's what I did in the beginning. And then when Evolus came out with Jeuveau, I'm like, you know what? Let me just try it. I didn't, honestly, part of the reason was because I wasn't very happy with like the Allergan people, like because I wasn't like a huge practice with like so many, vials and product being purchased that like they gave me like no mind, So then the Evolus rep was like so sweet and nice and showed me some love, and I was just like, let me just try it. I've been very happy with Jeuveau, and so most of my patients have either switched from Botox or Dysport to Jeuveau, at least if they want to, keep coming to me. And I still, but some have said like if they are used to Botox, I don't carry Dysport, but if they are used to Botox, I always have, some stock available. And
Hmm.
for some of my, patients who just refuse to switch or who just, they figure like since it's been around the longest, it's the best, and that's what they want. I'll just, I'll treat them with that. But I find that it works exactly the same.
You use the same units, like same
Yeah,
everything.
same
Yeah.
thing. And it really just the result is no different. It's been surprising to talk to some of my colleagues, I guess from around the country. Our colleagues have said like, yeah, like they love Jeuveau, and others have like just hated it and said that like it just doesn't last and all this stuff. But honestly, I mean, my patients are pretty discerning, and like I mean, I don't think they'd keep coming back if they were unhappy. So I think it works just fine.
Yeah, I have Jeuveau in stock too, and I definitely use that as well. And I found that I think it's I haven't found much of a difference in any of them. Nobody's really come back and said, you know, specifically
Right.
Jeuveau didn't last as long. I think it kicks in a little faster than Botox, so I think people like that. I like it too. I think in my practice, I have people like tried and true. So
Hmm.
the conversation about trying a newer one, even though the technology and the science isn't new, is harder. But I would say like for Jeuveau, I like using it in the upper lip for lip flip because I like the precision. I think it gives a little bit more like pout, and it kicks in about 5 days. So for Jeuveau's
Yeah,
nice
yeah,
there. So
yeah.
I
No, my patients have been, yeah, happy.
really like it.
Yeah,
Yeah,
yeah, for
and
sure.
so I think all of them are
Cool, cool.
great. I read a study comparing the different neurotoxins and like
Hmm.
what if there's any difference in like uptake or diffusion, and basically they said that they're
Hmm.
all very similar. The only thing I thought this was really interesting, the only thing that affected like the ability for it to work was temperature. I don't know if you read this, but like they
Oh.
said if the skin is and the muscles are cold, it doesn't
Hmm.
take up the product as fast.
Oh.
Oh no, I think that was interesting. To me it meant like don't like if you don't want to like ice beforehand, maybe ice after, but didn't seem like that was a huge issue. But I guess they're all the
Yeah.
same. They all work the same.
Yeah, yeah. I mean, they're also similar. But yeah, I actually don't really use ice in my practice. I, did in my training. It was just kind of a routine thing. And then I just, slowly stopped offering it. And I found that some patients were more irritated by it. And
Hmm.
just, I don't know, just don't really use it, and everyone's fine. You know what I mean?
Yeah.
So I haven't really found it to be very helpful. We talked about needles versus cannula. Anything else you kind of want to add about sort of how you decide one versus the other, or we covered some of it.
Yeah, needle versus cannula. So I would say if I can use a cannula, I will.
Okay.
There are some areas that I find sometimes I think I find it's more direct to use a needle. So for example, if it's mainly zygoma here, I will do periosteal injections right here. To me, it's cleaner.
Me too.
Yeah, it's cleaner. If I'm gonna go here and here, then I'll use a cannula because
right.
We're just the reach. I can reach multiple areas with one spot rather than poking 10 times, But if I'm gonna do 3 pokes on each side, I'll use a needle. For me, for lips, needle only.
Yeah.
Needle
we
only.
agree on all this stuff. It's as if we talked about that, we planned it this way, but
right?
It's just, that makes sense to me too. Yeah, that's what
Yeah, needle only. And I just really, really find the precision is so important with the lips. There are some cases that I will use a cannula for lips, and those cases would be if we're doing upper lip lines as well. And that way I'll fan this way, and I might go right into the lip just to, balance things out. For me, the cannula across the upper lip lines, it helps to spread the product more, evenly and, break up tissue to.
Yeah.
That's probably more your area.
No, I use for like if I have to dissolve filler, especially before surgery, I'll use hyaluronidase with a cannula. But otherwise, I typically will use the needle in the lips. But for dissolving, since like you said, sometimes injections are done higher up into the kind of the white lip, the philtrum. So I'll just to not have a million pokes with the needle, I'll use a cannula just with like at the commissure, entering on either side and just dissolving it that way. Yeah, but I agree with you for the cheeks for sure if you're doing periosteal. One area where I started with needles but I transitioned to cannula is actually nasolabial fold. Like I said, I try to avoid it, but when I have to do it, I found that like a low point entry where I can still get the entire length of it with the cannula works really nicely. And I really try to go very superficial as the cannula will go. It's not, it's hard to guide it, very superficial, but I'll like put extra effort into redirecting it so it's very superficial. And actually, sometimes I'll direct it then a little bit deeper as well. But I don't know, but it's never, to the depth of where the artery would be. But I just found that to be nice because when I did like the serial needle injections, the filler started to come out of those little holes. And then, so it's like, and especially in, some skin, you have to kind of like keep doing it to really get the contour to change. And like after a certain point, you've done too many needle sticks and it's just like pouring out.
Definitely in high risk areas, like right at the, the corner of the ala there. I like cannula for that. Sometimes I'll actually take an approach this way. If I'm going to do cheeks, I'll come in this way, just a little here, which just pops that out without having to fill the whole nasolabial.
Right.
How about, do you do temples?
I've honestly managed to avoid temples in my practice.
Yeah.
I haven't. Maybe one patient asked me about it. I find that it's the type of procedure where a lot of times the provider is pointing it out to the patient rather than the other way around. So I've had very few like actual requests for that. I also don't like market myself for like, injecting temples, I guess. But yeah, I haven't really had too many people ask me for it. And I just don't find that aesthetically most people really benefit significantly from that. And I feel like it's easy to overdo it. And plus it's like not the most fun area to work in because of all the vasculature. So it's an area I personally avoid in my practice. I've done some like lateral brow filler work, not a ton, but some. But I guess I just maybe just try to avoid the temples. I don't get much satisfaction out of doing them, but surely there are people who might benefit, but it's not a huge thing for me. But what about for you?
I'd say like probably it's a very low percentage of people who would truly benefit from it. I would agree. Not everyone wastes in their temples as heavily, but for the people that have really a lot of loss in their temporal area, I think it can be really, really helpful. But it's one of those areas that it requires a lot of product. Your result overall, I think, is it's not as dramatic as a lip or or a cheek. So
Yeah.
it takes the right person who's willing to see your vision and say, like, I trust you, and I think I never noticed that before, but now I see it, and
Well,
now
that's
it's,
what I mean. Like, that's not something that they really come in complaining about.
they don't come in complaining about it. I think there's more people out there who might benefit from it, but could they also benefit from mid-face filler, cheek, lips, other areas, nasolabial? Yes. Could they
Yeah.
benefit from, from doing a little toxin? Yes. So if you're gonna, budget your funds toward your skin and your face,
Yeah.
temples are lower on the list. It's like
Right.
temples and jawline, I think, are
Yeah, I've
lower,
definitely
you
done some
know?
jawline for the people requesting it, but it's really the people with like the boxy jaws, they want to get more like narrowed, and the
Yeah,
ones with like a really narrow jaw, they want to be, like, more
right,
pronounced. So everyone wants what they don't have.
right. Do you do masseters? Or do you treat those
Yeah,
a
yeah,
lot?
I
Or
do
yeah, yeah,
masseters.
yeah. I think that's
Yeah, but that's what I'm
actually
saying.
probably the
Sometimes,
biggest
yeah.
change.
Oh, go ahead, Zach.
Oh, I was saying that's probably one of the biggest, dramatic, the most more dramatic changes you could have, and it's just toxin. It's not even fillers,
Yeah.
but it's a lot of product, and so it takes the right person who's willing to, to see through on that,
For
I
the
think.
masseters.
Yeah, yeah,
Oh yeah, no, I think it's great. I always tell people not to expect a major change after the first treatment. And so I tell them this is something they have to kind of commit to more than one treatment, most likely. Granted, I usually do see a change after one treatment, but I just want to have it in their mind. So for something like TMJ, it's great after just one treatment. But for like a cosmetic sort of aesthetic change, I like people to come back, in 3 months, and we do it again. I mean, unless they had a dramatic effect after the first treatment. But yeah, I
right.
mean, I think it's definitely an area that, like with anything else, I mean, it can be sort of screwed up and you can get the rasorias and cause smile changes. So definitely, that's, I guess, a more expert technique. I think, like there are so many people these days injecting. I mean, I put that, somewhere on the list, I think at the bottom. I added it in because I just wanted to chat about that, but I guess
Yeah,
we'll get through other stuff and we'll come back to maybe who should be injecting,
sure.
because that's a whole other story.
Okay.
Combination treatments, I mean, are you often doing the injectables with like lasers and other things, or not necessarily?
I'd say not necessarily, but I in my practice I have Airlays. Airlays is a microsecond YAG laser, and it does like a facial rejuvenation kind of a through heat, so building up heat for inducing collagen growth. So I would
Yeah.
say, like, I do have that. Like, you can do that in combination with injectables if you have rosacea or something like that. But as far as, I would say that generally the visits are injectables or like skin, and then we discuss everything. But skincare is skincare, or like the superficial skin, and then the volume loss and that part is, they're
Yeah.
kind of separate. I mean, obviously you want all of it together, but generally I think
Yeah.
my patients tend to prefer to separate them so we can kind of focus on one thing or
Yeah.
another.
Yeah. Cool. And then when do you tell someone that maybe they should seek surgery or a consultation for surgery? Because, there are patients who are, older, and they just, everything's kind of sagging. But like, do you have that conversation with most of those patients, or you just kind of wait for them to tell you that, they actually are interested in surgery? Kind of, how do you tackle that? Because, my perspective is different because of like what I do. But I am always curious to see how other people sort of handle that side of it.
Yeah, I mean, and I'm definitely interested in hearing your perspective as someone who does surgery. I would say there's a couple of things. So if someone comes in and they say, I want to look like this, or something, I'm pretty straightforward, and I say, I can't do that for you. If you're, pulling, if you're pulling your skin and this is what you want to look like,
Right.
I'm just like, there's no way I can give you that result. So expectation building is really important. So I will say, listen, we can help you, make subtle and small changes over time to, in a year from now,
Yeah.
get you to a better place if you're willing to do that,
Right.
and take that journey with me. But I can't do something one and done, like, very quick. There's other times where I will tell people that they may want to speak with a surgeon. So Eyelid drooping is one that I find is a common question. So they'll say, can you do Botox or fillers because my eyelids are heavy? Is there a way to lift that? And I tell people, like, we can maybe adjust the lateral brow like a millimeter or 2 millimeters with toxin and some, well placed. But if you are, finding that you are compensating for heavy brow by lifting your eyebrows, and you may want to just consider going and having, at least talking to a surgeon, because the problem is your heavy lids are causing you to keep your eyebrows up. Keeping your eyebrows up means you get lines. Then you want Botox for the lines, and then you're in a cycle. And I actually just had this conversation this week with someone. I can't fix the heavy lid. There's no amount of Botox or fillers that I can put into like lift one eyebrow off enough that your eyelid doesn't touch your lashes. I can't do that. So that's another area that I'm a strong proponent of. See a surgeon. As far as I know, it's an outpatient surgery. It's, they can, depending on maybe how severe, but it's something that, some of my patients have done and they're very, very happy. And then the other times that I will suggest a surgeon or surgery would be for someone who wants with upper lip issues, I guess. So long philtrum, long upper lip, who comes in for lip fillers or wants a lip flip, with toxin, and they're just not getting the result they want. And I will have a frank conversation, like, you have thin lips, there's tissue there, but it's just not coming up. The way to really get a protrusion of your lip is probably surgery. Is that what you'd want to hear from your referring doctor?
Yeah, I mean, I guess my perspective on aesthetic medicine is that there's like all the different options that exist out there sort of in the world, and the list of possibilities, especially of like different modalities. And there's pretty much, I don't think there's anyone out there who offers all of them. I mean, it's rare to find someone who's truly offering, especially for the face, the full range of everything from skin care to facelifts and doing it really well. I think that's like, just doesn't really happen. So I just try to tell people, like, based on what I know about, other sort of specialists and modalities, and what else is out there, I just tell them like what I think they really would benefit from, and some of those things I might have, some of those things I might not have, some of those skills I might not have, and then I let them kind of decide. And and if it falls in line with my skill set and they're there and they want me to help them, great. If there's like a machine such as like FaceTite, for example, that I don't have, but if they have some droopiness to their neck but they don't really want surgery, I tell them about this thing that exists that might be able to help them. I don't have the machine, so I'm just going to send them there. But I think, I don't know, my perspective is that it's important to kind of know what exists out in the world, and it's okay to let a patient go if you can't provide them that service that maybe is best fit for them. So I guess that's kind of how I approach things. But then like when a patient comes to me with an aging face complaint, I feel like they've kind of decided before they step foot into the office if they want surgery or they don't want surgery, at least at that time in their life. And I'm not the kind of, maybe I'm not a great salesman, but it's hard for me to like, if they want injectables and they've got severe jowling and the neck's really lax, and I'll tell them I don't think injectables are the right thing for you. I think you need surgery. Unless they're like mentally and just kind of prepared for that, they'll never be like, oh, well, I was gonna get just some filler, but now that you said that, it makes sense. Like let's do the surgery. So it's just it takes time. Maybe they'll come back in 5 years and want to have that conversation. But I feel like a lot of people, they ruminate about the stuff at home, talking to friends, and they kind of already have made up their mind which direction they want to go. And even if I give them my honest opinion, it rarely sways them necessarily one way or the other. Even with like severe like hooding and an extra skin in the eyelids, like you think it'd be so obvious, like, look at this, you have this extra skin, I have the skills, I can do this for you, can make it happen. They're like, no, I just want a little Botox. Okay, like so I feel like it's hard to change that kind of course unless maybe you're just great at selling something. But I think it starts with just educating people. But most of them initially, I find that when they come to me, they have something specific in mind, like let's talk about this surgery, or let's talk about injectables for this area. But I still, I'll still be honest with them if I really don't think it's going to help them. And then if it's safe to do, I might still do it, but I'll kind of try to talk them out of it first. I run into this a lot with thread lifting. People will ask me, oh, like, can we do some threads? And I'll tell them all the bad things about threads. And I'll be like, well, if you still want it, we can do it. But you have to understand, the downside. But then again, I'm that way with surgery too. Even if someone doesn't ask me about, well, what are the downsides or the complication risks and all that, I'll make sure to share that with them, because people need to know risks of filler, risks of, lip lifts, facelifts. So I just like for people to be informed, and then they decide what works for them.
I totally agree. I do think I agree with you that people come in with a preconceived idea of what they want because their friend or someone they know had something. And I think in general, most people have already thought about the options, surgery or not. And I think, a lot of them just don't want to be put to sleep. They don't want that risk. So that's why they're coming in, asking about injectables. And I think just making sure that they are truly understanding the goals and what fillers or, neurotoxin can do, and that it can't give you the thing, that you're, the full thing, like all this, but it can help. And so I always say, like, look, we can try, let's do some, some toxin in the platysma. It's going to help a little with some of the lines, but it's not the same as, what you might be really wanting, but maybe that's enough for you. And you tell me, you let me know. And it's gone both ways. Like, some people are like, wow, I can't believe it's so amazing. I'm so happy. Just that little bit, those little pokes helped. And some people will say, you know what, I didn't really see a difference in that. So we're not going to do that. And that's okay. And I'm going to accept, whatever area is how it is until I'm ready to do more, let's say. So yeah, I think they already know. And I think that as long as you're clear, like, with your patients, like, I can't give you the result, that full result, but I can help you. I can help you, guide you to a better place, like in a year from now, if you stick with it,
Perfect. Yeah, no, exactly. Yeah. I think honesty goes a long way. I've seen it done, and especially in New York City, where, people are promised quite a bit, and then that's not what they get, and they get very upset, so I get patients from certain other places, med spas, some other docs, and it's not like like the doctor or whomever performed like a really bad job. It's just that they didn't really tell the patient what they should can expect and what problems could occur. I think if you tell people that and they still decide to do it, well, then there's like shared responsibility.
Right. So. In a way, undersell. I always say you're going to be underwhelmed.
Yeah.
I don't want to look fake. Look, I promise. Look, with 1 or 2 cc's of filler, you're not going to look fake. Like, you're going to look well rested, and you're probably going to want more, actually. So we're just going to stick with 1 or 2 to start, kind of thing.
Yeah. No, I like that approach a lot. A couple of things left here. So to improve kind of patient comfort and reduce pain with these procedures, what's your kind of go-to? Do you have like I don't know, any kind of special regimen or way of doing things?
So I would say, like, my best technique for reducing pain is talk therapy, is talking through it. And also, obviously, like, I prefer using cannula. One of the reasons is for pain tolerance as well. I think most important is you have to prepare your patient for what they're going to feel. Hey, you're going to feel a bunch of needle pokes, or hey, you're going to feel something maybe under your skin, and you're going to hear some noises. You're going to think it's hurting, but it's not. So they're prepared for it. And for some, like for fillers, maybe lip fillers, I'll have people pre-ice, like ice their lips if they want. Hi, Jolene. And I would say, like, for lips, I've had patients come in and say that they've had their lips filled and it was the most painful experience ever, and they're afraid to do their lips. And then, finally we talk, and I said, let's do it. Like, I think you're going to be happy. And I use a needle. I don't numb beforehand. And I think that with appropriate technique and appropriate technique, talk therapy that all my patients do amazing. So no blocks or anything. That's so.
And you do you use the topical numbing at all, or?
I don't use topical. I mean, I have it,
Right.
and I can certainly prescribe it for people if they want it. And I have them, they can put it on at home. But even for lips, like I feel like you put it on and then it gets in your mouth, and then you're like, then your throat is numb. It's like
Yeah.
it's messy. So I think like in a way, it's like not that I definitely don't want my patients to suffer. I don't like to inflict pain on them, but there's some sort of feedback I like to know. Like if I'm injecting something and you're having severe pain, I need to know that at the time, I don't want you to be totally numb. So I don't know, that's my technique, and I think my patients do pretty well. And even I think all my patients are super tough, and they're real troopers, and they have to be, you have to want it.
Yeah, yeah, you have to go through that little bit of discomfort. What are your thoughts on do-it-yourself injectables? You probably have heard about this, but they get sold on the internet, and so there are people buying the stuff, looking up YouTube videos, and just kind of injecting themselves. I've had
Yeah.
at least like one person come in with a complication from injecting her own nose. I mean, I know it's nothing good, but like, kind of,
Oh
where
my
do you
gosh.
see that trend going and that sort of thing?
Gosh, I would say, yeah, no, I'm definitely not a proponent of injecting yourself. I also have had a patient who bought something online and injected herself with it. And maybe we make it look too easy, or some, I don't know, like maybe maybe we're not, maybe in a way as physicians, we're like, no, no, we got it. This is no big deal, but it's a big deal. It
Yeah,
takes years of training. You need to know the anatomy. There's not just that. There's actually years and years of just figuring out,
yeah,
someone's lips, how to inject them, or someone's cheeks, where to inject. It's not
right.
just like, we don't just like kind of, I don't know. I think we make it seem like it's more straightforward than it is in a way. Maybe because that's just what we do all day.
Okay, no,
Okay,
perfect, perfect. It was just
all right.
reloading.
It's not as easy as it looks. It's harder than it looks, getting the right look for whatever area you're injecting. You can buy the injectables online, don't come with dissolving agent in case there's an
Right,
issue. That's dangerous. If you can inject in a blood vessel, you have necrosis, you need to call someone. And when it's 9 o'clock and you're sitting in your bathroom injecting, there's nowhere to go. And actually, I don't know how many ERs are readily stock hyaluronidase or
right, right. I
Vitrace
don't
or
know.
anything.
Yeah,
I don't It's not a usual thing for them to manage. So that's what I would say about that part. And then the other thing about buying your own injectables is you really don't know what's in it.
right,
These are not, going through a rigorous process of FDA approval, et cetera. It could have hyaluronic acid in it, but it could have other things in it too. Also, there's so many different kinds of that. One of the most important things I like to know if I'm going to reverse an agent or a filler is which one is it, so I know how much I'm going to need.
yeah,
You know that, right? Like it's kind of like if it's something that's not
right,
cross-linked,
right.
I might not need as much. But if you're using something that's going to last longer, you might need to flood the area with a ton of
Yeah,
reversal
that's
or
a good
dissolving
point.
agent.
That's a good point. Yeah, it amazes me how some patients, they don't even know what they were injected with. They come from other clinics, and I ask them,
Hmm.
and it's so important for patients to ask. I mean, yeah, of course, the internet, God knows, but even if you go to like whatever certified provider, you just don't know what they're using. There are people out there still using silicone. So it's just, I think, so important for patients to ask their provider, like, well, what are you going to use for me? Might not
Hmm.
even be an HA filler, and we just these days assume that they were injected with HA. So yeah, no, all really good points. We're coming up on the end here because it's showing me a countdown of a minute and a half. So I guess,
Oh,
how do people how should patients choose their provider? I mean, as quick as you can with the.
Oh my gosh, in a minute.
Yeah, really
Gosh,
fast.
do your research. Look for a board certified, plastic surgeon, dermatologist, facial plastic surgeon. Who am I missing? Oculoplastic.
Oculoplastics, yeah.
Yeah, board certified. Look at their before and afters. Do a consultation. Meet with them. Make sure you jive with them. They could be the best at what they do, but they need to understand what you want, and how to communicate. You have to be able to communicate with that person well. Not everyone's a good fit for everyone. It's okay. I'm not going to be the right doctor for every patient out there. But
let's assume you are the right doctor. How do people get in touch with you, Carolyn?
Okay, I'm in Rhode Island in East Greenwich. I have a boutique practice. You can find me online, RIDermaInstitute.com. I do online booking. I do consults. I do all the injectables, thread lifts, laser, chemical peels, PRP. So
Caroline, you're
I'm
awesome.
around.
Thank you so much for joining me, and
thanks so much. This was fun.
Chatting soon off the air.
Awesome.
All right, thanks. Have a good night.
Thanks, you too.
See ya. Bye.
Take care.